Good evening, Excellency, ladies and gentlemen. Welcome once again to Cambodia Global Dialogue of Southeast Asia TV. Tonight, we have the pleasure to have with us Dr. Laura Watson. You wonder, Dr. Laura Watson is not, you know, an economist or an agronomist. No, she's a medical doctor. And we'll be talking on a subject that for almost a year have not been touched. We've been covering economics, trade, global issue, financial crisis, agriculture, rice, and I thought that it's time that we touch on the soft issue facing as much the competitiveness of this country. You know, when your health of your population is not doing well, when the amount of day of sickness of your worker is not well, when your management team is going to Bangkok, to Singapore, to France for medical treatment, it does affect the competitiveness of the country, the productivity of the country. So, but these are more the larger issue. But I want to have the opportunity to discuss health issue that facing Cambodia as a whole. So again, Laura, welcome to the show.
Thank you very much, Siphana.
Yeah.
Thank you for inviting me.
Yeah. So I really want to say thank you on behalf of the studio and the audience that you come to share with us. For me, I'll be honest with you, I don't know much about the health issue, so we're going to be mumbling quite a bit all along, right? But perhaps before we start, Laura, you may want to say a bit about yourself and about the organization you work with, so that the audience have
Sure.
a bit the context. Yeah.
Okay, so I've been in Cambodia since January 2004, which is coming up for 8 years.
Oh wow! 2 more years you celebrate.
Absolutely. We arrived with our family, 2 small boys, the youngest of which was 10 weeks old when we came, so he is pretty Cambodian. I've been working for International SOS since May 2004.
Yes.
I'm a British-trained family physician. So I work at International SOS as a general practitioner, family doctor. I have a special interest in women's health and family medicine.
Yes.
Also tropical medicine, emergencies, that kind of thing. For those that are not familiar with SOS, we are the world's leading international assistance and healthcare company.
Yes.
We have offices all around the world. We support globally, we support companies and tourists and travellers and governments to keep their workforce healthy when they're overseas.
Yes.
And then there's a network of clinics through mostly in Asia, but also in remote sites, mines and oil rigs, places like that where we have remote site clinics.
Yes.
I'm very much based in Phnom Penh,
Okay.
where we offer really quality healthcare to individuals and companies.
Yes. Well, Laura, you know, 8 years in the country, you probably have seen pretty much a spectrum of not only the international visitor, the foreign worker, you know, who come to your clinic, but also you have a broad understanding also on what's facing the health issue in Cambodia. How would you describe the health issue in Cambodia generally?
Yeah, I mean, certainly in 8 years we've seen huge amounts of change, and that's one of the things that makes it exciting to live in Cambodia, is the country is developing and changing very fast.
Yes.
The health problems facing the country, as I see it from where I sit in a private clinic, seem very different depending on where you live and on your income level.
I see.
I think the health issues facing the people in the countryside are still mainly those of poverty.
Yes. What do you mean by health, poverty-related health? You know, what's that? In plain
diseases,
English?
Diseases related to lack of sanitation, lack of access to clean water, diseases of poverty, malnutrition. Still, the simple infectious diseases and simple vitamin deficiencies even are very common in the countryside. Women and children are still dying of diseases that really shouldn't be preventable.
In urban city. So are you trying to say that there is clearly a rupture in terms of specificity of the disease, right, in the rural area and the urban city?
Absolutely.
And so you mean in the urban area is different?
Yes, yes, and of course within the urban area there's also still a great deal of poverty, and you still see those diseases, but there's also a very large now and growing middle and upper class where people are educated, they have income, they have access to a different kind of diet and different kind of lifestyle, and so the diseases that we're more familiar with in the West, heart disease, diabetes particularly, those things are increasing rapidly in Cambodia and becoming much more of a significant problem. And what you were saying about economically facing the country, you know, time lost through really premature illness from people who are involved at business level, certainly is becoming a significant problem. Yeah.
So in the urban city, you would say that it's more a lifestyle sickness, a disease, versus people in the countryside, which is more a poverty-related sickness, right? Lifestyle, you mean what? Because they don't exercise enough, or they eat the junk food, or what?
Yeah, both of those things, absolutely. Absolutely. You do see people out exercising, and I love to see that. I love to see the groups of people doing aerobics and people out jogging in the mornings, but it's not enough.
It's not enough.
And one of the things that I think town planners could do, for example, is make sure that there's enough outside space, park areas, places where people can safely go to exercise. They're not having to fight with the cars and the motorbikes to jog down the street. In terms of diet, you know, processed food. Now we're getting a lot of different fast food restaurants coming to Phnom Penh and Siem Reap, and the traditional Cambodian diet is actually very healthy. Lots of fish, lots of vegetables, lots of fruit. You know, I love to see taxi drivers, motor-dock drivers snacking on fruit in the street. You don't see that in my country. They're snacking on French fries or something like that. But now it's becoming more and more that the French fries and the fried chicken and the Coca-Cola and the fizzy drinks are becoming more popular. And then the consequences of that are then of the diseases that go along with that: obesity, heart disease, diabetes, hypertension.
You see a lot of diabetes. What causes diabetes?
Diabetes in particular, well, Asian people, to generalize, but Asian people in general have a predisposition to diabetes. And so if you become overweight and you eat too much sugar and you don't exercise enough, your body doesn't produce enough insulin, you can't process your sugar properly, and you can develop diabetes.
But if you exercise enough,
but if
you reduce your sugar intake, you're okay, right?
Absolutely. And if you are detected as having what's sometimes called borderline diabetes, then you can do a lot to prevent that becoming full-on diabetes, such as you say, lose weight, exercise more, eat a healthy diet.
Oh, I feel good then. Yeah, because I exercise. You know, I have to cut down 2 sugar to 1 sugar. Today, I start today, see, mainly because I say, oh, I'm going to see Laura, I better behave. So today I'm starting the beginning of a healthy 1 sugar coffee rather than 2 sugar. No, I mean, but it's true, because I see many of my friends, you know, we're about same age, you know, early 50. You know, some are a little bit obese. You know, some take a lot of medicine. Speaking of taking a lot of medicine, I'm appalled because you know you go to your physician, your doctor. I have to tell you this joke, right? I won't disclose. I used to be sick long time ago. I walked to this clinic, and you know, the doctor say, okay, so, lay down. So I lay down. Then he disappeared in behind his curtain. He come back with the whole syringe already there, like whole like this already, right? And then he saw the Freudian slip. He forgot. He said, "Oh, by the way, where you hurt? Where you sick?" I said, "Oh my God, doctor, you haven't asked me. And what is in that thing? What is that syringe?" So you see, it's a little bit traumatic, you know. I mean, that's when I realized, my God, I mean. Maybe just pure vitamin, I don't know. But what appalls me is that every time you come back from a doctor, they give you this, you know, bag of pill, no label. You don't know what you're taking.
Yes.
I mean, what's your view on this?
Yes. That's a subject very close to my heart. I will often get people coming to see me for a second opinion, and they will come in with a bag of pills, and they're all different colours, and they're not labelled. And I say, well, what are you taking that for? And what are you taking that for? And often they have no clue.
Yes.
And often they feel terrible.
Yeah.
And one of the reasons why they feel terrible is because they're taking 10 different sorts of medication, most of which they don't need. There's a lot of interactions. So yeah, it definitely could make a big difference to an individual to always know what you're taking. Why would you put something into your body when you don't know what it is or why you're taking it?
Exactly.
So I think the expectation needs to be there from the patient that they get an explanation as to what pills they're being given, what they're for, what side effects they might have, how long to take them for, how to take them, etc. But also that the doctors need to be expecting to be asked that question. I think sometimes that relationship can be still quite paternalistic.
Yes.
Doctor knows best. I'm going to tell you what to do. You don't ask me questions. Whereas in a modern doctor-patient relationship, it's a relationship. It's a discussion.
Yes.
So there are these 2 pills you could take. This is the side effects of one. This is the side effects of the other. Which one do you think might be better? Yeah. And it should be a discussion.
Yeah.
So.
Is this because it's more this, when you say this paternalistic approach, is it more a cultural thing? Asian versus a Western way of looking at health, that sort of thing. You see a difference
partly,
in that?
Partly that.
Right?
I think it's partly sometimes if the doctor's not quite sure, they can feel a bit nervous. And it's something about confidence. I think if you're confident in the medicine that you practice and in your diagnosis, then you have no problem explaining and discussing that with the patient.
Yes.
If you're not quite sure, then you might feel nervous about being questioned. Yeah. Some of it, though, is also about the patient expectation of needing a medicine.
Yes.
So sometimes when we go to the doctor, we don't always need a medicine.
Yeah.
We might just have a viral illness.
Yes.
Sometimes reassurance is all you need.
Yes.
Maybe some paracetamol.
Yes.
But if the patient is always going to the doctor and feels like they haven't been well treated, if they leave with nothing or only one medicine,
they feel
then maybe they feel like they haven't been well treated. So it's also on the part of the patient, their expectation of what they should get.
So it's a mind change as well. It's a paradigm shift on how you view your expectation, you view your relation with your physician, with your doctor. Okay, but I'm sorry, I'm more thinking as a policymaker, right? I mean, how this 30 minutes of dialogue, how we can help influence a bit the change, the process of policy making, the regulatory process. Because for a least developed country on the way to become a middle income country, it's important that we have the right regulation, because if not, it's a free-for-all. And I think in education is no different than in health sector. I think the role of the public sector is very important in setting the policy, the regulation, the norm, because the public, to be fair to the public, things that you mentioned, they don't know. So it should be a big responsibility of the state, of the ministry, to set the state in terms of regulation, in terms of, and then if we move a little bit upstream in terms of at the university level, when you become a pharmacist, when you graduate to become a medical doctor, what is the expectation? What's your view on that?
And there's a couple of different aspects to that. In terms of education, in terms of education of doctors, I think a real focus on quality needs to be there. And there have been some achievements and some improvements, but a great deal of focus needs to be on quality, and not only on specialist care.
Yes. What do you mean by specialist care?
By specialist care, specialists like a cardiologist or respiratory physician or a surgeon. That really needs to be just the top layer of medical graduates. In most countries that have developed healthcare systems, the bulk of the physicians will be family physicians.
Okay.
So they're dealing with the day-to-day stuff, not the really complicated, detailed stuff, but dealing with advice and health advice and fairly simple things, simple infections and minor surgery, things like that. And that training level of that bulk of people really is a gap. So there could definitely be some family medicine training improvements to be made.
So in this case, you were saying that they're more focused on the specialization field, right? Okay. And then disregard a bit the mass.
Yeah.
when you think that it's more the opposite, that I would say that those who really need most the advice, the day-to-day will be dealing more with the bulk of the family doctor.
Yes, and when everyone is a specialist, it means that patients end up doctor shopping. So they go from clinic to clinic to clinic to clinic because maybe they have a stomach pain.
Yes.
So they see a gynecologist.
Yes.
It's not a gynecology problem. Then they see a gastroenterologist. It's not a GI problem.
Yes.
Then they might see somebody else.
Yeah.
Whereas a good family physician or general practitioner can take all of those things and say, no, I know what you've got, because they know a little bit about everything.
Yes, yes.
And you really reduce that, and that reduces cost as well, because many people in Cambodia spend huge amounts of money on healthcare.
Yes.
You can bankrupt your family if you have a chronic problem, and you end up spending a lot of money on investigation after investigation after investigation, where actually the problem might even be psychological.
Yes.
And I think that more holistic focus on the family or as an individual, rather than always specialization.
For me, I'm a bit philosophical on that, in the larger sense that I believe that, sometimes, when people open a business, I can understand you're a businessman or you're a businesswoman, it's fine. But I think there are certain areas where people should not be open, that particular business for the sake only of business. Because, like I say, if I open a toy store, it's okay. I run this business, I open a bookstore, I run a business. But when you have a clinic, when you have a school, right? Private school, whatever, right? I think the primary objective should be education. It should be health provision. And then if you do it right, the business will grow, you will make money as a result, right? But it should not be the other way around. We should not be, oh my God, I'm going to make money. Wait a minute, there's an opportunity in health. I'm going to go to health. But for the sole purpose of making money, I'm going to open the school for the sole purpose of making money. And then the education, the health become the secondary. I think it's a wrong way to think,
I think we all have some social responsibility, and every company should be having a social responsibility and doing something to improve the life of their employees, and also their clients or patients or whoever they may be. Absolutely,
I think in the medical field as much as in the legal field, which I'm a lawyer myself, I think ethics is very important. But again, ethics is internally driven also, right? But I'm looking more from the larger society perspective, from the government regulation. Do you think that there should be more regulation to set the norm in the health sector?
It's a good question, and we were talking earlier about junk food and processed food and things like that. I think you certainly can look at that. I think it's very important now to look at advertising of things like cigarettes, which are becoming more and more unacceptable to advertise and promote smoking
worldwide,
and alcohol even worldwide. Absolutely. And it's not only the wealthier countries that are making these bans and limiting what can be done. Also trying to provide incentives for people to eat healthily. One of the issues in the past has been that cheap food tends to be the stuff that's bad for us. The high fat, high sugar food is often the cheap stuff. So in the West, whereas here it's a treat. It's what people, when they've got a bit of money, they might go and get some fried chicken or a pizza or something like that.
You're right.
But I think the government can do a lot in terms of promoting a healthy diet, in terms of providing some health education, in terms even of regulating who and how are allowed to come into the country, are allowed to set up businesses here. I think they can certainly promote healthy diet.
Disclosure, labeling.
Yes, absolutely.
I think it's important that, when you buy, sometimes I see a bottle of water, it look from far, it look like there's some disclosure. When I look closer, everything is zero, right? So if it's all zero, why you have to put it, right? See, that sort of thing like this, I think you're right that there have to be a stronger monitoring of what go inside a certain processed food, because the public wouldn't know. I mean, to be fair with that. So you think spot advertising, health issue, this is helpful, right?
Yeah.
Helmet is important. I think talking about health, talking about jogging.
Yeah.
I'm distressed, because sometimes you see accident, you just distressed because, that person shouldn't die had the helmet, right?
Yeah.
Or if the person is not dead, or at least be handicapped for life or something like this,
Yeah.
What's your view on that?
Yeah, I mean, there's the physical toll of having a head injury.
Yes.
But there's also the economic
Yes.
impact of that, and it's often the young men
Yes.
who drive too fast, who
Yes.
don't have a helmet on, who are the ones who are victims of some of these horrific accidents. Absolutely agree with you. I think the government's introduction of rules for helmet wearing
Yes.
is excellent.
Yes.
When we first arrived in 2004, almost no one wore a helmet, and now at least there are a lot of people wearing helmets.
Yes.
It's so important. I think everybody who has any friends or family or employees in Cambodia needs to insist everybody wears a helmet at all times and drives carefully. The consequences of these accidents, which we all see on a daily basis,
Yes, on a daily basis, it's clear.
are horrific.
Yeah.
Yeah.
And I was even told by a friend who worked in ministry, they say that we used to be scared of HIV, but then the thing is on decline. You go to Calmet Hospital, you see a increase not of HIV, but of accident, prone relating to traffic accidents.
And so preventable.
Yes.
It's so preventable.
Yes.
Yeah. And your brain is so important and so soft and vulnerable.
Yes. Look, Laura, I can tell you, you mentioned this word, your brain is so vulnerable. I think our body is vulnerable. I do karate, and I know that, our body is so fragile. I mean, and the problems that, nowadays with all this new movie, special effect, you see, Arnold Schwarzenegger beating the other guy to death for 5 minutes and the guy still walking with no bruise, right? I mean, that's bad, because people think that our body is strong. It's not. When you practice, you realize that a small thing, you be like, you twist your finger, that's 2 weeks, 2 months,
Yeah.
So I think it is a clear public message that need to be told, to be very careful of that.
Yeah.
Laura, I want to give you the last word. What do you want the public to, in terms of message, to remember from this short discussion? Health-wise, preventive health, whatever is your
in terms of personal preventative health,
yes.
I'm a little obsessed by exercise. So
Okay.
I would say, number one, if you don't use it, you will lose it.
Okay.
So everyone needs to be physically active every day.
Yes, yes.
And the second one is wear a helmet.
Wear a helmet.
If you're going to ride a motorbike, wear a helmet.
Yes.
Protect your brain.
Yeah.
Yeah.
Junk food?
Junk food is bad for you.
Yes.
It's a cliche, but we are what we eat.
Yes, yes.
So if you want to be a pizza, eat pizza. If you want to be, a delicious bowl of clear Cambodian fish soup with noodles, then eat the healthy Cambodian fish soup with noodles.
Yes. Well, I have to close the program, but talking to you, I feel a bit guilty because I have brought Cambodia to WTO, liberalize the economy, but unfortunately, there's some good side and there's some downside of liberalization, and this cultural injection of this modern food, this processed food, is probably not what I expected in those days. But thanks for sharing the view, and yes, let's go back to our traditional healthy food. We tend to be excited to see a new pizza shop opening, but then there are plenty of good restaurants across the river that offer some good Cambodian diet. So I think I will remember that, and exercise.
Absolutely.
So thank you, Laura, on behalf of the studio and the audience, and I hope we have the opportunity next time to talk to you, not in your capacity as a physician, but in our capacity as a member of the board, and you as the chair of the International School of Phnom Penh.
Okay.
But when we, next time, in a few months down the road when things are clear, I want to invite you back I want us to discuss the future of education. Right?
Sure,
Today is health,
exciting.
Tomorrow will be education.
Why
and
not?
To me, these are the two fundamental pillars of the development of this country. Right?
Yep.
So,
okay.
all right, good. Well, Excellency, ladies and gentlemen, as always, 30 minutes is too fast, but I think we have a glimpse of at least what we should do to keep not our sanity, we're not insane yet, but at least, our health, so that we can become productive. But also a larger message to the audience is that, we have to be more respectful of life, of our own body. Do not mistreat. When things happen, it's not only you who get broken arm, it's your family who will suffer. And if you are not rich, you could destroy your family just through medical bill. So wear helmet, exercise, be healthy, and think of your family. So I think on that note, I think it's very clear that today we have more or more value, lesson, best practice than an economic rate of return value from the economic perspective of the country. So again, I want to say thank you, Laura, and I see you all next week. Good night.